Coming up on Network Africa. A team of WHO officials arrived in South Africa to help in the country's fight against COVID-19. Mozambique and the Gambia declare state of emergencies in their countries to limit the spread of the coronavirus. Plus, Tunisia to send food aid to Lebanon after Tuesday's deadly blast in Beirut. Thanks for joining us on the program. I'm Teniola Shoboale. We begin today in South Africa, where a team of World Health Organization experts have arrived in Johannesburg to help the country in its fight against COVID-19. South Africa is the hardest hit on the continent, and so the WHO is deploying more than 40 experts to support the health ministry of the nation. They are to assist in various fields such as surveillance, case management, and infection prevention and control, both at national and state levels. As mandated by the country's health ministry, they are going into isolation for 14 days first before starting their work. Our South Africa Bureau Chief, Betty Dibia, joins us now for more. Hello, Betty.
Hello, Teddy. How are you?
Very well, thank you. Help us understand, was this arrival at the request of the South African government?
Well, you could say so. It's a result of a series of consultations or discussions between the Health Minister of South Africa, Dr. Zweli Mkhize, and the leadership of the WHO at regional and global level. So now, but what we understand is that the WHO will be funding this program, will be funding the search team, all 43 of them, but those who have arrived, that's the first batch, is just 17. They arrived today and they've gone into quarantine. But South Africa will be responsible for the administrative resources to ensure their initiation, as well as merging or combining with the local team. They will be embedded in several provinces. For now, we have 5 provinces. That's KwaZulu-Natal, Eastern Cape, Mpumalanga, the Free State, and Gauteng province, which is the epicenter. So that's where it is. And because we know South Africa is number 5, or the top 5 of affected countries, so the WHO saw it necessary to agree or arrange for this search team to be in the country. And we have various experts, including one of the people who led the severe acute respiratory syndrome epidemic program in 2003. That's Dr. David Heyman, who will be part of the team to be in the country. I don't know if he's among those who have arrived, but he certainly will be among the 43 who will be coming into the country.
Now, as you mentioned, some of them have gone into a 14-day isolation. But after that, give us more details on what their work would be during the duration of their stay after the isolation.
All right. Well, you've listed some of them, the list of their expertise. They will be part, or they will join, or they will be embedded in several provinces where they will join the local team already on ground. And you remember that the Cuban doctors too, or Cuban health personnel, are still in the country. They're supposed to be here for a year. So it's just the more, I don't want to say the more the merrier, but the more the stronger the support for the efforts to combat the hotspots, especially in the country. So they will be part of the WHO Director General or Regional Director for Africa, that's Dr. Matshidiso Moeti, will be coordinating virtually from Congo. And then the WHO Health Emergencies Program, the Executive Director, Dr. Michael Ryan, will be in Geneva, coordinating as well, co-coordinating virtually. So they will be part of all the teams in the several provinces, especially the problem areas that I listed earlier, those 5 provinces, in areas of epidemiology, surveillance, infection prevention and control, mobilization, health education, community mobilization. So these are some of the areas. And South Africa has moved now from mass testing to targeted testing in problematic areas. So these are supposed to help. They have areas of expertise. They will support the experts already on the ground, the locals and those who are from other countries as well. And they've worked we've seen them work in other countries like China, Spain and Italy as well.
Betty, I was actually going to ask how South Africans, especially medical workers, are, reacting to the arrival of the WHO experts, especially, when the Cuban doctors came to the country. It was sort of a mixed reactions between the medical workers. How are they reacting to the WHO experts?
I guess everybody realizes we all need help. So the fear with regard to the Cuban personnel was, oh, maybe they're coming to take over our jobs, which is a very common expression in this country. But once the government has assured people, we haven't seen much reaction or negative reaction with regard to these experts coming from the WHO. That's a global body, so maybe the acceptance will be much more. And these are even far more experienced people. So we haven't really seen anything negative for now. We don't know how that will work out, when they will get embedded in these communities. But for now, we're just hearing, oh, they're here, and these are the things that they're going to do. They're coming to support. I think the acceptance will be a bit better this time, with better understanding as well, because many areas need help, need support, and are quite overwhelmed.
All right, then, Betty, on Wednesday, Health Minister Zweli Mkhize was cautioning and warning that a second wave risk still remains in the country. How are citizens doing in terms of adherence and compliance to guidelines put in place to reduce the spread of COVID-19?
I guess they're doing just like regular citizens are doing elsewhere. Many people are finding it hard to adhere. Some are adhering and are hoping that it wouldn't get to them. But the reality is that people at this point know someone personally who has been affected by COVID. But the statement of the minister stems from the fact that over the past few days, we've noticed a reduction in the 24-hour turnover of the figures. So we've seen changes from 13,000 to 11,000, and over the past few days, we've seen 5,377, 4,456. New cases. So he's saying, please do not relax. And the death toll is rising, but the recovery rate has gone from about 58 to 71. And he's telling them, please do not relax. And let's continue what we're doing, as simple as washing our hands, putting the face masks and sanitizing, just to ensure that we maintain this or just hit the plateau and then start going down. That's just it. That's what, it just makes sense to ensure that we keep it up and not relax so that the numbers won't start going up again.
All right, then, Betty, thank you so much for joining us on the program.
Thank you very much.
Still in South Africa, the National Treasury has granted a request by the country's alcohol industry for a deferment of excise tax on liquor. The proposed 90-day deferral will be on excise taxes to be made in August and September. Last month, the sector applied for the deferment of 5.1 billion rand in excise tax owed to the Revenue Service until the ban on the sale of alcohol is lifted.
It's proposed that the 90-day deferral will assist compliant businesses in respect of payments of excise taxes on alcohol for August and September of 2020. The ban on the sale of alcohol has led to significant operating uncertainty, says the SAB Vice President for Finance, Andrew Murray. We asked him how much difference this tax break will make.
We're very grateful at SAB and as an industry that the Treasury has taken the time to understand our business model and has chosen to take actions to address the realities of our business model and the situation that faced our industry with the decision of a tax deferral. We have not yet been able to trade at full levels. We're currently not able to trade at all. And we don't have any clarity on when we'll be able to trade again and what degree to which we'll be able to trade, which operating hours, which days, etc.
The tax payment break comes after AB InBev's South Africa unit, South African Breweries, said it's halted plans to spend 5 billion rand on scheduled plant upgrades. Glass manufacturer Consol Holdings Limited said it's suspending building a 1.5 billion rand production plant in the country. And Heineken NV also confirmed on Tuesday it stopped work on a 6 billion rand brewery.
When the 90-day period expires, they will have to make payment of those excise duties, and so SARS will then, the South African Revenue Service will then collect those funds. And so from the point of view of the manufacturer, it's just buying them some breathing space and effectively giving them some credit.
The alcohol ban has also affected President Cyril Ramaphosa's drive to lure $100 billion in new investment to the country by the end of 2023, as alcohol companies continue to halt their investments. The government says the ban was introduced to curb alcohol-related hospital admissions, which were hampering COVID management efforts.
Now, clear evidence that the resumption of alcohol sales has resulted in substantial pressure being put on hospitals, including trauma and ICU units, due to motor vehicle accidents, violence, as well as related trauma that are alcohol-induced.
South Africa is among a handful of countries globally that outlawed alcohol as part of an effort to curb the spread of COVID-19, and it has cost the industry about 117,000 jobs, according to manufacturers in the industry.
Still in southern Africa, Botswana's government has banned the sale of alcohol and suspended all liquor licenses. A notice issued in the Government Gazette said the suspension was until further notice. All liquor stores will remain closed. The reason given for the ban was that alcohol had a negative effect on adherence to COVID-19 protocols. Last week, the government reinstated a strict lockdown in the capital for 2 weeks to curb rising cases. The country has to date confirmed 804 coronavirus cases and 2 deaths. Mozambican President Filipe Nyusi has announced another 30 days of emergency from Friday midnight in a bid to limit the spread of the coronavirus. This is the second time the country has declared a health emergency since March, when it confirmed its first case. In a televised address, the president outlined a phased easing of restrictions, including the resumption of classes at higher education institutions, military academies and technical training institutes on the 18th of August. In phase 2, starting in September, cinemas, casinos and gyms may reopen, and the third phase, starting in October, will see final year students in secondary schools resuming classes. It's a similar situation in the Gambia. President Adama Barrow has declared a state of emergency and introduced a nationwide night curfew for 21 days as coronavirus cases keep rising. The president said the borders and airspace will remain closed except for cargo, diplomats and those seeking treatment abroad. The country has recorded nearly 700 cases, including 16 deaths. The vice president and 3 ministers are among those infected by the virus, but the president tested negative on Monday. Worship places are to remain closed in the country, and schools will only allow final year students to sit for exit examinations from the 17th of August. All markets and shopping areas will close every Sunday for cleaning and fumigation. Still ahead on the program. Thousands of Somali students sit for entry exams despite the COVID-19 pandemic. Details in a moment. Stay with us. Thanks for staying with us. Here in Nigeria, efforts are ongoing by state governments to cushion the effects of the COVID-19 pandemic, especially among vulnerable groups. In collaboration with the government in Yobe, Plateau and Delta states, the private sector joined in to distribute palliatives to various households.
Since March, when the coronavirus pandemic hit Nigeria, the government has continued to roll out various interventions in form of palliatives to help bring succor to the less privileged. To complement the efforts of the state governments, a private sector coalition against COVID-19 is handing over food items for distribution to households across the country. In Yobe State, northeast Nigeria, the initiative is targeted at the physically challenged.
It has come to the right time because the restaurant is just shutting down. So most people are running out of foodstuff. So this one will complement their shortages.
We welcome you, Your Excellency.
While in the North Central, over 35,000 households across the 17 local government areas of Plateau State will be beneficiaries of the relief materials.
The gesture by Kakobi will definitely extend the frontiers of what we have been doing by reaching other vulnerable persons who did not benefit from the previous efforts. For this distribution, Kakobi has set out clear criteria for identifying qualifying households that will benefit from the food relief program. Our role as a state is to facilitate this process based on defined guidelines.
It's a timely intervention in Delta State in the South-South, as the state government not only gives palliatives to the residents, but makes a big announcement.
We're also hoping that in the next few weeks, we'll have 2 other test centers, one in Warri and one in Ogara. We are looking forward to having those centers open.
The distribution of palliative, consisting of food items and cash, is part of the federal government's efforts to help cushion the economic impact COVID-19 has had, especially on the most vulnerable in the country.
The Nigerian Foreign Ministry is announcing an evacuation flight to Abuja, Istanbul, scheduled for Friday, 7th August 2020. Nigerian nationals in parts of Europe can purchase the Turkish Airlines ticket from their current locations on the Turkish Airlines website or via mobile application or from their sales office to connect the Turkish Airlines flight from Istanbul. For more inquiries on future flights, prospective passengers can contact the Turkish Airlines in Abuja, Lagos and Port Harcourt through these channels you can see on your screen. Meanwhile, the Foreign Affairs Ministry is denying allegations by some Nigerian students of frustrating the evacuation process from the Kingdom of Saudi Arabia. The ministry says, contrary to the students' claims, the Nigerian mission in the Kingdom of Saudi Arabia, in line with federal government guidelines for the evacuation of Nigerian nationals stranded in different parts of the world, has been engaging relevant host authorities to facilitate the evacuation of Nigerians from the kingdom. The students, in a viral video, alleged that the government of Nigeria, especially the Ministry of Foreign Affairs, Abuja, the Embassy of Nigeria in Riyadh, and the Consulate General of Nigeria in Jeddah, deliberately refused to facilitate the evacuation to Nigeria for holiday since the 15th of May 2020, adding that the Consulate General of Nigeria in Jeddah refused to issue permits to students and failed to secure overflight clearance and landing permit for the Saudi Arabian Airlines to airlift Nigerians from the kingdom. However, the ministry is asking the public to disregard the allegations by the students as they are false. Schools in many parts of sub-Saharan Africa remain closed due to the coronavirus pandemic. In Somalia, the closures have further crippled an already fragile education system. Despite the closures, though, Somalia's government went ahead with exams for over 34,000 children from 618 schools across the country, imposing strict measures at the examination centers to try to curb the spread of the virus.
In the sweltering seaside port of Mogadishu, Omar Mohammed is sitting his end-of-school exams at a school turned into an examination center. Mohammed has secured a place at a university in Mogadishu where he hopes to study information technology. The examination results will come out in August, and the 17-year-old is hopeful he will pass. But studying at home has been a struggle for Mohammed and many of his friends.
It was so difficult for us to prepare the exams. We missed some classes. At the beginning of school year, we attended classes really well. But with the COVID-19 outbreak, our schools closed.
In March 2020, schools were closed in Somalia to help curb the spread of coronavirus. Millions of Somali children have no idea when they will be able to return to class. Despite the measures, the Somali government says that 34,550 children had taken exams from 618 schools.
As a ministry, we have decided to give students a chance, especially those that have been studying for a long time and are ready to pass out. COVID-19 prevention measures like using face coverings, gloves, and observing social distancing will be followed. We have also doubled the number of exam centers.
The ministry has also doubled the number of exam centers to help maintain social distancing. The country so far has reported 3,178 cases and 93 deaths.
Away from the COVID-19 pandemic, the Tunisian government is sending 2 military aircrafts to deliver food supplies, medicine and medical equipment to Lebanon's capital, Beirut. It's a help after an explosion which shook the whole city on Tuesday, killed at least 113 people and injured more than 4,000 others. Lebanon's president said the blast was caused by 2,750 tons of ammonium nitrate, which is used as a fertilizer and an explosive stored on safely in a warehouse at the port. Tunisia is among a number of countries who have offered humanitarian assistance to Lebanon. Egypt is also another country that has sent a military plane carrying medical aid containing food packages sent by Al-Azhar University. Dozens of people are still missing, and up to 250,000 people were left without homes fit for living in Beirut after shock waves smashed buildings, sucked furniture out into the streets and shattered windows miles inland. Our prayers are with the people of Lebanon at this time. And that's the program today. Thank you so much for watching. I'm Teniola Shubowale.